So I chose to become a physician because, I've always had a basic interest in sciences in general through school. I also have healthcare in my family. My father was a family practitioner where I grew up in Idaho, and I got to see his interaction with patients in a small town where they had a lot of respect for him, and I recognized that, and I think that really touched me in a way. So I realized that was something that I had interest in pursuing. My practice here in Eau Claire is a little bit unique in that I do have some subspecialty training. My general training is in neurology, and then I did a fellowship in epilepsy. And I think that's a void that needs to be filled here in this community. Epilepsy is one of the most common neurological disorders that we face. And I think comprehensive epilepsy care in general includes a number of different things that you have to touch on with these patients. And I think having the sort of extended training to know kind of those unique aspects of patients with epilepsy is tremendously beneficial. So when I meet a patient for the first time, obviously there's a lot that goes into trying to present yourself in a way that makes them want to continue to get their care through you, and also you respect your opinion and follow your recommendations. I've found that since practicing here for the past little while that one of the things I've enjoyed more than anything else is asking patients about their interests. I grew up in a small town in Idaho, a different region of the United States, and then for the past little while I've also been down in Arizona before coming here. And I've realized that people's interests in general are tremendously different here, what they do for hobbies, what they spend time doing with their families, that kind of stuff. And so just asking them about those sorts of things I've actually greatly enjoyed, along with I think it does make the patients a little bit more comfortable in general. My family I get great enjoyment from. I'm married, I have a wife, and then we have a young son. I've never realized that I would enjoy something as much as I've enjoyed being a father. I really enjoy spending time with my son and also spending time as a family all together. There's a number of different activities we like to do, anything from spending time outside with my son at the park or just outdoors in general, to doing things with my wife, like going out, exploring the area a little bit. We really enjoy doing that, being somewhat unfamiliar to this region. So we really enjoy doing all those things. I'm Dr. Scott Spritzer in neurology.